Have you ever seen one of those commercials for a rheumatic disease and wondered, what is rheumatology? Well, it's a study of autoimmune diseases. Normally, our body's immune systems are able to recognize viruses and bacteria and attack them in order to keep us healthy. But with an autoimmune disease, the immune system is confused and attacks the body's own cells, causing a whole bunch of problems. Today, we're going to focus on a disease called scleroderma, meaning thick skin. The cause of scleroderma is unknown, but it mainly affects women ages 30 to 50, but it can also affect men as well. But what is scleroderma anyway? The body normally produces a certain amount of the protein collagen in the skin, but with scleroderma, the body produces too much collagen, which causes the skin to expand and get thicker as a result of inflammation. That's why scleroderma means thick skin. There are two types of scleroderma, localized and systemic. The localized version of scleroderma is limited mainly to the skin, and it is more common in younger patients. The symptoms are often represented by the acronym CREST. C stands for calcinosis, which are calcium deposits on the skin. These often look like white dots or grains of salt. R is for Raynaud's disease, which is the lack of oxygen flow to the fingers. Oftentimes, a patient's hands, when they get cold, the fingers will turn white or blue because the oxygen cells contract or get smaller. Then, when the patient's hands are warm again, the fingers will turn red because of the sudden flow of oxygen back to the fingers. This is a very serious symptom, and it can result in loss of fingers and is often the first sign of scleroderma. E is for esophageal dysmotility, which is just a fancy way of saying that the esophagus becomes rigid as a result of inflammation and very stiff. It can cause acid reflux. S is for sclerodactyly, which is the thickening of the fingers. Oftentimes, the fingers will become tight and stiff in these very rigid and warped positions. T is for telangiectasis, which means the swelling of the blood vessels, which can appear in many different ways, but oftentimes it appears as big red dots on the skin. Systemic scleroderma is much worse than localized scleroderma because it affects the entire body. It can affect the heart, the lungs, the kidneys, pretty much any major organ. It's more common in older patients, and the symptoms include CREST. And it's again very serious. Scleroderma, however, is a heterogeneous disease, meaning that it affects every single person differently. And it is also chronic, meaning that there is no great magical cure that will save the patients. But through science, we work to find treatments that will help improve the patient's quality of life. Thanks, that's all for now.